Our next presenter is Colin Lamb. He's a medical student at Mount Sinai. He did his undergraduate at Emory University, where he majored in neuroscience and behavioral biology. He also did a master's at Icahn School of Medicine and Biomedical Sciences before medical school. He has previously done research in pharmacology and neurosurgery. During his master's, he was working in my lab, where he was working on the pilot study for our Clitomas project. He also is now working with Dr. Margettis, where he developed an IRB-approved database of scoliosis and spine surgery to perform retrospective studies. In addition to his academic studies, he also has industry experience and is a co-founder of a consulting company called MedStar Consulting to serve the allows medical students to fill staffing gaps in outpatient clinics in New York City. And in his free time, he enjoys soccer and surfing. Look forward to hearing from you, Colin.
Well, thank you so much for that introduction. Just going to go ahead and share my screen now. Okay. Yeah, so I'm very happy to present the work I did with Dr. Margettis and Dr. Lahner on evaluating scoliosis as an independent risk factor for critical illness in COVID-19 patients. So first, I'd just like to acknowledge the incredible effort made by healthcare workers around the world, and particularly highlight those made at Sinai. Faced with an unprecedented volume of critically ill patients, Mount Sinai adapted and innovated to care for New York City while simultaneously driving the field with researching this disease, developing treatments, and publishing guidelines for hospitals around the world to care for their own communities. I highlight here just a few of the really impactful articles that our own department had developed early in the disease of the pandemic, showing the association between ischemic stroke and COVID-19. So as we continue to manage patients with COVID-19 and better understand its chronic sequelae, Mount Sinai is again advancing patient care with a Center for Post-COVID Care Patients, which is a multidisciplinary approach to helping these patients return to baseline after suffering from long COVID. So just a brief background on our COVID. It's a respiratory virus that can cause significant disease in older patients and those with chronic comorbidities such as immunocompromised patients, metabolic disease, and lung disease. While vaccinations and advances in acute treatment have significantly reduced the risk of critical illness, many of these patients are still at risk for requiring hospitalization and even ICU level management. While with the emergence of new strains and outbreaks in our population, research on risk factors for severe disease remain important. So the goal of this study was to determine whether scoliosis, which has been shown to cause significant respiratory impairment, presents as a significant risk. Scoliosis is a common deformity in the spine, occurring in about 8 to 9% of the population, and it can range from a slight curvature to a three-dimensional helical turn in the spine. While deformity in the spine can present in all planes, it's commonly assessed in the coronal plane. Within a healthy patient should form a straight line. The deviation from the straight line is called the Cobb angle, which is measured by identifying the angle between the two end plates most tilted towards each other. Scoliosis is defined as a Cobb angle with greater than 10 degrees of curvature. Mild scoliosis is within 10 to 25 degrees, moderate is 25 to 40, and curves greater than 40 degrees are classified as severe. These classifications, along with functional impairment, help guide our management. As the degree of scoliosis is negatively correlated with the respiratory function, as you can see in this graph to the right. Cobb angles greater than 65 to 70 degrees are often associated with significant respiratory impairment. These large thoracic curves alter the geometry of the thoracic cage, inhibiting vital inspiratory and expiratory muscles, reducing the compliance of the chest wall and ultimately leading to a restrictive syndrome. So for our study, we used the COVID-19 database that was assembled by the Mount Sinai Data Warehouse to identify 19 patients who had positive PCR results and ICD-10 codes for scoliosis. And these patients were recruited from March 2020 to June 2021. Of the 190 patients that we recruited, 61 of the patients were excluded due to age being less than 18, active pregnancy or cancer, and significant imaging to assess the scoliosis, previous scoliosis deformity, or COVID vaccination. This left us with a total of 129 patients. To evaluate our Cobb angles, we had two independent measures confirm the angle of the Cobb angle using supine images of CT and X-ray taken within 1 year of their positive result of their COVID-19 test. The apex and degree of the major curve was used to describe the location and severity of the scoliosis. Subjects were grouped into no scoliosis, as we see below, mild, moderate, and severe scoliosis. Our outcomes of interest included a hospital and ICU admission, acute respiratory distress syndrome, endotracheal intubation or mechanical ventilation, and mortality during their hospitalization. So this is our table of our pre-infection characteristics of our scoliosis cohorts. We compared them using Pearson's chi-squared and ANOVA tests. The cohorts only differed in age, but were somewhat reasonably close to each other. The mean Cobb angles are also displayed below, with their apices all being located in the thoracic or the thoracolumbar areas. Then we did an unadjusted and adjusted multivariable logistic regression model controlling for age, gender, body mass index, and some of the other relevant clinical factors that we listed in our first table. We use this to really evaluate the effect that the degree of coronal scoliosis can have as a predictor for critical illness. None of our analyses reached a level of significance. So this led us to our conclusion that scoliosis was not an independent risk factor for critical illness in our population of COVID patients, nor were there any trends to really indicate a consistent degree of the effect of scoliosis on these adverse outcomes. Our study was limited by all of the pitfalls of doing a retrospective design, as well as our patient size. Because of the limitations of some of the imaging, unfortunately, we weren't able to evaluate sagittal deformity, which can also lead to a degree of respiratory compromise. This is something that we're looking to investigate in the future. In our supplemental analysis, we also looked at the patients who had severe scoliosis, and only 5 of our patients, which amounted to about 16%, had scoliosis greater than 65 degrees. And that level of scoliosis is normally correlated with respiratory impairment. So that may have also led to our negative result. So I just want to thank Dr. Margetis and Dr. Lahner for supporting this research, as well as my fellow students who engaged in this research with me, and as well as the neurosurgery department for supporting me in these efforts. Thank you so much.
Hey, Colin, it's Alex. Thanks so much and congratulations on a great project.
Thank you.
One thing I was worrying about with this cohort is, did you find any delay in treatment in terms of scoliosis correction for these patients? Something that's been shown in other pediatric hospitals is that delayed care in AIS patients during the pandemic, which is extremely crucial, especially as these kids have growth acceleration through the pubertal phase. So I just wanted to know if you guys had looked at this to see if any cases had to be delayed or moved or surgical plans had to be changed because of the pandemic or because of their COVID infections.
No, we actually weren't able to look at that, and because of this, it was a retrospective design, so we didn't evaluate that. But during my literature review, there's actually a lot of studies published on the effect of the pandemic on delaying a lot of these cases, and the potential harm that could have for especially the pediatric population.
Thank you.
Thank you, Colin. That was actually, the result was surprising to us. Initially, we're thinking that that scoliosis would have been a risk factor. So we're actually pleasantly surprised by the fact that this doesn't seem to be the case. And that's very important information for many patients with scoliosis who were afraid that they were probably at much higher risk, and they were living with that increased concern about what will be the COVID effects on them. And I think that the results of this study that saw that probably the risk is the same for them as for the general population is very reassuring for these patients.
Thank you very much. Any other comments? All right, we'll move on to our final speaker.